I'm sorry, I'll make this quick so that everybody can get home. My name's Diane Cruickshank. I'm a general practitioner in a small animal practice in Victoria, British Columbia on Vancouver Island. We are an 11 vet practice. We're the largest practice on Vancouver Island. I have been there for 12 and a half years. So one of the benefits that we have there is that we do see quite a large caseload. And this year we've had and to us this was a very exciting case. And probably to us fellow geeks, you would understand why. So anaplasmosis in a dog on Vancouver Island. First of all, I have to say that this was my case, but I am not the one who diagnosed it. My head technician, Jennifer Kowalski, I have to give her the credit. Without her, we may have never diagnosed this case. So, okay, which button do I press? That one? You're on the right? Okay. All right, so my case started on a Sunday morning. I think she came in about 10 o'clock. Ginger. Ginger is a 7-year-old female spayed yellow lab. She lives in the Highlands, which is a municipality that's part of the Greater Victoria area, and it's mostly made up of acreages up in the Highlands. So that's where she lives, and that's her backyard. So she came in, and she presented, like I said, on the Sunday. She had a 1-day history of lethargy, anorexia, and with a stiff gait. And a 7-year-old yellow lab that comes in, kind of walking a little stiffly. She was slightly hunched over. And as fellow veterinarians, you might guess, first thought, foreign body. She ate something. And she did have a history of possibly getting into some garbage. She had vomited the day before. However, on talking with the owners, I did discover that they had removed several ticks from her over the previous weeks. And we've had on a very high tick season, and I'm saying this anecdotally, just my own impressions from 12 years, that this year we seem to be hearing a lot more people taking ticks off their dogs this year. And the owner later told me that he actually had removed 2 ticks out in the parking lot before they brought her in. There was absolutely no history of travel. She had not been off the island in a couple of years. When I examined her, she had a fever of 40.3 degrees Celsius. She was depressed. She was standing very stiffly, slightly shifting her weight off of the right hind leg. One of my first thoughts was Lyme disease, yet honestly, in 12 years, we've never diagnosed Lyme disease. We know it's out there, we just never diagnose it. I examined all her joints. She had absolutely no pain response, no joint swelling, and she had no abdominal pain because, of course, one of my thoughts was a foreign body or maybe a peritonitis from a foreign body, especially with the fever. She was mildly dehydrated. All other her parameters were normal. So we did some diagnostics, x-rayed her abdomen looking for signs of a peritonitis or a foreign body, and also did some blood work. Nothing really abnormal except she had some arthritis in her back, which is not uncommon. And then on her serum chemistry, everything was completely normal. It was boring. However, on her CBC, she had a panleukopenia, low white blood cells. She had a severe thrombocytopenia, 2 to 3 platelets per high power field. And the interesting thing, and this is the fun part of this is what got us all excited, is that by this point I was in another appointment, and all of a sudden I heard my technician Jennifer yelling from across the clinic, "I know what this is! I know what this is!" And the reason being, and this is why she's such a rock star, is that she saw these things. And she looked all over the field and all over the slide, and she found them in about 27% of the neutrophils. And she had remembered an article that she had read from 2005 about anaplasmosis in a 7-year-old male chocolate lab, exactly the same weight, presented with the exact same fever, from 2005. In Victoria, and it was a paper that was submitted by a fellow veterinarian in town, And she remembered reading it. She pulled it out, and the pictures in it were almost identical to this. This is actually Ginger's blood, and the pictures were identical. So our number one differential was, at this point, Anaplasma. Ehrlichia was on my list as well. And the reason I say Ehrlichia, even though it is not known to be found in the ticks on Vancouver Island, we did have a positive Ehrlichia case in a small dog about 2 years ago that had never traveled, but her neighbor had a new Mexican dog that they had gotten within the last 6 months who was positive for Ehrlichia. So it's one of those that we're not really sure. We're not really sure what it means for the future. We're not really sure if we're going to start seeing Ehrlichia on the island, but it was on my list. So there's my list. All right, so at this point, I still needed to differentiate between the two because both Ehrlichia and Anaplasma can have the morula in the white blood cells. So we sent her blood to the IDEX laboratories in Vancouver, which is our veterinary reference laboratory, and they did an ELISA test for antibodies, which included all of these things. Ginger was negative. Shit. Now what do we do? However, when we communicated with the lab, because we were confident that it was one of these things, when we communicated with the lab, they informed us that they can have a negative if it has been an acute infection within 7 to 14 days. So we resubmitted. We still had blood from her because by this point I had started her on treatment. So we could not take any new blood, but we still had some left over. So we resubmitted it, and we had them do a PCR test, which tests for the Anaplasma DNA, and Ginger came back positive. And then it was, the species was determined to be Anaplasma phagocytophilum. And this was exciting because in my 12 years, I'd never seen it. We heard of one case from 2005, and that was it. So what is Anaplasma phagocytophilum? It is a gram-negative bacteria. It causes, and in people, the symptoms are fairly similar. The clinical signs are fever, lethargy, depression, anorexia, and muscle pain. So basically the same thing as the flu. The vector in the Pacific West Coast is the western black-legged tick called Ixodes pacificus. This is the life cycle. You can't see it very well. But the important part is that the transmission to humans or dogs is here, and it's the spring and the fall. And she was infected in February, and in Victoria, that's the spring. Our flowers are out. So I treated her with doxycycline for 21 days, a little bit of prednisone, just to make her feel better. Also was a little worried about possible IMHA, immune-mediated hemolytic anemia, because we weren't sure, thrombocytopenia. She made an absolutely uneventful full recovery. She bounced back within 3 days, and this is her today. So she's back up hiking in the highlands. The owners are now, it was very interesting with this case because the owners were so pleased that we could diagnose it. They were so happy with us, and yet I didn't do anything really. They were huge advocates on Facebook. This is where social media is wonderful. Huge advocates on Facebook of spreading the word around to all their neighbors and all their friends about getting their animals on tick prevention. We have a lot of ticks around Victoria. I don't know what it's like on Vancouver Island or Washington, but this year, like I said, it seems to be a much heavier year. And anaplasma is only one disease that, we've seen this year. There has been another case of anaplasma that I know of. That was up in Nanaimo. And the only reason I know about it is because the owner of the practice is a friend of mine. The problem in my world is that we don't have a central area that we can record these diseases and that we can go to find out. I'm sure there's got to be more of these out there, but I don't know. We don't know. We can't find out. And so it would be nice, and this is the first time I've come to this, and it would be really nice that in the future to continue talking between the human health and the veterinary health to try to, can use these cases as, are these cases canaries? Dogs do get more ticks than humans do because humans can see and we can brush them off. But are these the canaries? There's another few diseases that we've seen this year besides anaplasma that I haven't seen in my previous 11 years. In Victoria, we've had 5 confirmed cases of leptospirosis, and I've only heard those by speaking, just hearing about them in the community. And I've had a case of toxoplasmosis. So I don't know if these diseases are emerging more or are we testing more for them? Are they going to be significant in my world? Are they going to become more significant in the human health world? I don't know. But that's Ginger. I'd like to thank, of course, again, Jennifer Kowalski, my head technician supreme, because honestly, without her, I don't think we would have diagnosed this. We might have, but it might have taken a lot longer. Dr. Malcolm McCartney, who's the owner of the practice, also the co-author of the paper. We wrote up our case and it was submitted and it was printed in the CVMA, which is our National Veterinary Association, the journal. It was submitted and printed in July. I also like to thank Ginger's owners because for they allowed me to use her name and her pictures. So, any questions?
Any questions?
So, first sample serology was negative, but did you manage to get a second sample?
No, we didn't. It was recommended to the owners and they declined.
I see. Okay.
I know, that's too bad. But she's perfectly healthy now, so to them it was irrelevant.
We worked this up on the BCCDC side when we heard about this case and the case in Nanaimo. We were quite concerned about these being indicators or sentinels for the disease being present in the environment and therefore also being a risk to humans. And we did speak to Vancouver Island Health Authority. They'd never had any cases reported to them, and they were to speak with some of their clinicians, and as far as I know, nothing has come of it. But I wonder, Morsha, if you wanted to comment on our ability to find this in the environment or to produce more evidence of where this may be.
Yeah, whatever I said goes negatively, so about the Lyme and Anaplasma and everything. So everybody thinks that I try to suppress everything, but it's not. We did huge amount of surveillance work. As you know, that BCCDC is collecting tick actively as well as passively from veterinarians like you and physicians. And we do test for Lyme. We do not test for Ehrlichia or Anaplasma for all of them. But very recently I got 2 years grant for doing active tick surveillance from across the province. And recently our paper have been accepted, published in one of the journal, Vector-Borne and Zoonotic Disease Research Journal. And we tested about 900 ticks. And this one, some of them we did the 16S ribosomal RNA on all of those, hundreds of them. And we didn't find any Ehrlichia. But I think one Ehrlichia we found, but that was also not Ehrlichia chapiensis, some environmental strain. So we have a very limited kind of cases or limited number of detection abilities from the environment. And for the physician and from the human side, that we are testing Anaplasma and Ehrlichia for hundreds of samples. Like any physician requested for Lyme, obviously they request for Babesia, Ehrlichia, Anaplasma, and many others. And if not all, most of them TEAT are below 1 in 64, means that they have no Anaplasma or Ehrlichia infection. So from the human side, that we are missing somehow. So this was a very good opportunity to show that we do have the element in our province, so that we missed the opportunity. I also asked that can I get some samples, and unfortunately I didn't get the sample because we wanted to verify. And verify means that we all wanted to check our methods, and we wanted to work with our national partner and National Microbiology Lab in Winnipeg. They are also interested in doing some work, but somehow, because if owner doesn't agree, then we cannot do much. So that was the limiting side. And also just to let you know that PCR positive doesn't mean that could be positive, could be something else was happening, but I'm not saying that that is not. This looks like a clear case. And identifying morule is a nice way of identifying anaplasma and Ehrlichia is very easy. And only my concern, this 27% neutrophil was positive for the morule, because she found morule in 27% of the neutrophil. And the dog was also highly, the platelets was very low. So in those two events, immunologically, we supposed to see antibodies, but we didn't see antibodies. So that is where I'm kind of struggling myself. I don't know what that is, but maybe we missed the case. But because that Ixodes pacificus is a competent vector for carrying anaplasma and Ehrlichia, so I have no doubt that they might have been in our province, but we missed this opportunity. That is what I'm going to say.
Thanks, Morchad. Any other questions? Thank you very much. That was quite an interesting presentation to close with. Definitely closes the gap between veterinary and human medicine.